Okay, so hopefully we can see the screen that I have shared. Yet. So Travis and I will be discussing just ways that communities and universities can partner together. I think this is a really nice transition from hearing about evidence-based practice. And one of the most important ways that communities and universities can come together is through evidence-based practices. And so just in general, when we're thinking about these partnerships, they can be in, when it comes to grant writing, program planning, program evaluation, community engagement. These are all opportunities that the community and the university can come together. And that's because the community really has the practical expertise, so they understand what's realistic for implementing programs. They know the community and really understand their need. On the other hand, universities have that research background, so they have the institutional resources just to get the journal articles, to have the books, to understand what the research base is, but they also have that expertise in reading the research articles, understanding the literature, and identifying what we commonly think of as evidence-based practices. But the thing to keep in mind when we're talking about evidence-based practices is we typically just think about research, but evidence-based practices is really three components. So it's research, so what's the evidence kind of say is important, but it's also practitioner judgment and client value. So you as a clinician understanding what is going to work best for your community and what are the values of your community, what services can be most easily implemented is all part of this evidence-based practice. And Travis is going to discuss kind of a planning process that we went through for putting together a grant application for KDOC grant for reinvestment funds. However, we really went through that whole evidence-based practice in a circuitous system to create this new program plan. So it was this idea that we started with risk factors that had been identified for these judicial districts in Northwest Kansas. And these risk factors were identified to be negative peer groups, lack of leisure time for youth, and from these risk factors, the study circles were able to identify what goals they have. So they wanted to have structured programs with positive peer support opportunities for youth to address the negative peer groups. And to address peer groups, they wanted after-school programs. And we took this information. So this was evidence in the sense that this was data from the community. It represented the risk factors, which were based on data, and it also represented the community values and what was going to be most easily implemented to create this grant application. So we were able to utilize both these community agencies with that practitioner judgment to implement and create a program around what communities find most valuable, along with kind of me from a research side being able to figure out what does the research say is most valuable. Because as I'm sure a lot of people have learned over the past few decades, the role of evidence-based practice has really morphed, and there's a really strong emphasis on outcomes and showing that your programs are evidence-based, and that's where kind of research can assist the community agencies. Community agencies, they don't have time to always evaluate the programs. They don't have time to read all of these research articles, and that's where a nice partnership with a university can really assist. So I will send it over to Travis to explain what exactly the components were in this grant application.
Thanks, Kristen. And as I'm presenting, you might hear some laughter and heads banging against the wall and all sorts of other noises. There's a daycare on the other side of my wall. So just enjoy the laughter as we go through this COVID season and bear with me. This was just a really great experience and one that Kristen mentioned earlier was really circular. And I served as the facilitator for our study circle in 3 judicial districts. And throughout that process, we identified peer support as one of those things, and peer mentoring is a really strong need throughout the region. Aside from this project, LiveWell has been working, doing a lot of community-based efforts around mental health and And those conversations really started to integrate with these, and it was really exciting. And so after we got the grant application, we started this really neat partnership that it just happened over a very short period of time. And that was between LiveWell and then the Northwest Kansas Educational Service Center, also known as the Service Center here in Northwest Kansas, Kansas State University, and the Family Peace Initiative. And how that started was as we were looking at peer support, we were trying to identify a workforce that we already had in the region. And so I reached out to Dan Thornton with the Service Center, and we began to have some discussions on what that might look like in terms of evidence base. And then we pulled in Mick Thornton, who works for Project Evers. I think they're both here on the Zoom call, talking about trauma and the work that they were doing. And then then Mick was connected with the Family Peace Initiative out of Topeka. And then finally, I would say Kristen was the glue that held us all together in terms of her work with K-State and the application and looking at the data and bringing us all together around a really nice application. And so as a result of all that really cool partnership, a 3-pronged approach was developed to provide peer support services to justice-involved youth. And what that involved was the first component, which was resilient youth, and really that idea of working with youth in programs such as after-school programs and peer support groups. The second prong of that was resilient homes, and that was in-home parent coaching. So throughout our service area, which can encompass 9 to 12 counties, depending on what the initiative is, we already had this workforce out there. How could we work together to work with families and primarily families where justice-involved youth were? How could we use our home visitors as a resource for that family? And so that was the second component of this approach. And then finally, the third prong was resilient schools, and that involved training school staff to become more trauma informed. As we look throughout the region, schools are, it seems like, incrementally becoming more involved in social emotional work. And over the past couple of years, I've seen an increase of schools that have really turned a focus to being more trauma aware for all of the teachers and staff within the district. And that's really cool to see happening throughout the region, especially in the time that we're living in now. So moving forward from here, we were pleased to know that we were awarded the grant, and that will start July 1st. And we're looking at training through the Family Peace Initiative, or we will be doing training through the Family Peace Initiative. Their methods include a batters intervention program, which really focuses on building trust and partnerships, a focus on adverse childhood experiences, or ACEs, and then other programs that lead to thriving individuals and families. So we're really excited to move into that work this summer, hopefully away from our computers and actually out in public again. But Kristen, was that get everything there? Did you want to wrap up with anything?
No, I think that was perfect. Yeah, just again, this was just kind of a case example of how multiple community agencies kind of partnered with the university to be able to conduct some program planning and grant writing.